Alright, so first I'm going to do an environment check. Next I'm going to grab a barrier and do a brain dump before I begin. There's nothing on the barrier before I begin.
And I would, if you don't have HF, I would put HF. I have HF. Oh, and put OPAC. Okay, there's so many considerations. I don't understand how you know which ones. I'm gonna take these out. I didn't write it down yet. But it's annoying too. So what am I saying to you? So what are we even doing here?
Me too.
But I'm gonna take these out.
Alright, so now I'm going to begin. Come in. My privacy. Hi, my name is Kira. I'm going to be your nursing student today. Give me your name. Can you give me your name and date of birth?
Just turn it, it's fine.
Oh, I thought you meant you have to start it.
No.
Okay. Name and date of birth? Kit 13603. Good. Scan your bracelet. Good. Do you have any allergies?
Nope.
Okay. So I would wear PPE if needed, and there is one part during this that I do need PPE. For supplies, a popsicle stick. I have my tool for testing Babinski reflex, cotton or gauze, alcohol pads. Okay. So today the physician has ordered a neuro assessment. I'm just going to check out your cranial nerves before we begin. Do you have any questions?
Nope.
Are you in a comfortable position?
Yep.
Okay. So first I am assessing your hygiene, which is good, your level of consciousness, which is good, you're alert, you're talking to me, you're orientated times 4, you're able to hold the conversation, your mood looks good, you're relaxed. Alright, so first I'm going to ask you 3 questions. Have you ever had a concussion?
Nope.
Do you get headaches?
Nope.
And do you have any vision issues? Are you forgetful?
No.
Okay.
From what we understand.
So now I'll move on to cranial nerves. So first I'm going to start with olfactory. Can I have you close your eyes? And I'm going to have you smell this. Close one nair. Tell me what this is.
Alcohol.
Good. Close the other nair. Tell me what this is.
Alcohol.
Awesome. So our olfactory nerve is intact. Our optic is the second one. I'm gonna have you read these letters in red. I'm gonna place it about 9 to 11 inches away from our face.
Adult non-sterile.
Good. And then I'm gonna test her ocular, motor, trochlear, and abducens. I'm gonna use my pen to do the 6 cardinal gazes. I'm just gonna have her follow it with her eyes. I'm watching for symmetry of the eyes, watching if they don't have stigmatism, which means they would shake. They look good. Alright. So next I'm going to do trigeminal. I'm going to take this gauze pad and place it on her face. And I'm going to have her raise her hand on what side she feels it and then tell me where at. Close your eyes.
Right. Left cheek.
Good.
Chin.
Good.
Forehead. Forehead.
Good.
Cheek.
Awesome. So far trigeminal nerve is intact. Next, I'm going to do. She is fully conscious. Her hygiene's good. Before we keep going, I'm going to ask you, do you know what day it is today?
Monday.
How'd you get here today?
Drove.
Do you have any kids?
No.
When did you graduate?
2021.
And where are you at today?
South Staff.
Why are you here?
School.
Awesome. Okay, so now I'm going to test your facial nerve. Have you smile, frown, raise your eyebrows, puff out your cheeks. Good. I'm looking for symmetry in the face, making sure both sides are the same. There's no drooping going on. Next, we have acoustic. I'm going to go behind you and make noise right behind your ears and have you raise your hand on what side it is. Good. Good. And then I'm going to whisper a word in both ears and have you repeat it.
Blue. Door.
Awesome. So her acoustic nerve is intact. Now I'm going to do her glossopharyngeal and vagus nerve. For this, I'm going to use gloves. And I'm going to need my popsicle stick and pen light. Alright, I'm going to open your mouth wide for me. And I'm going to press down your tongue with a popsicle stick. I'm looking for symmetry of your uvula and your mouth. Everything looks good. I'm using my light even to look for any thing else. Symmetry is good. Coloration is good. No redness or anything like that. I'm going to check the gag reflex for vagus. Oh, she has a good gag reflex. Can you swallow for me? Good. Yeah, open your mouth. Swallow. Alright, so her uvula moves good. Symmetrically. So next I'm going to do her accessory nerve. I'm going to have you shrug your shoulders against me. Good. So both sides are symmetrical with strength. Neither one of them are drooping or weak. Now I'm going to do the hypoglossal nerve. Kind of have you shake your tongue out. Move it side to side. Good. So her movement is good. She's able to move it to both sides symmetrically. I'm going to take off my gloves. I'm going to wash off my tool here and check her Babinski reflex, which I'm just watching to make sure her toes don't flare, which is not normal after the age of like 2 to 3. You take your socks off for me.
My toes are cold.
Alright. So we'll short off the side of her foot. Good. And good. So now I'm going to clean this. Alright, so that's all cleaned. So we got hypoglossal done. Now I'm going to do her stenosis. I'm going to draw a letter on your hand. Can you close your eyes and tell me what the letter is? A. Awesome. So that was good. And I'm going to do her superficial. So I'm going to have you close your eyes and raise your hand on what side of your body I'm touching and tell me what area.
Knee.
Good.
Shoulder.
Good.
Shoulder. Knee. Foot.
Awesome. So she feels it. I'm also checking both sides and upper and lower limbs to make sure everything's working correctly and symmetrically. So that concludes our assessment today. Are you in a comfortable position?
Mm-hmm.
I'm going to provide hand hygiene. Before I leave, do you have anything you need from me? I have time.
No.
Okay. So making sure the bed's down low and left. Her side rails are stable. Her table's in place. Her call light's within place. There's no obstacles in the way. And I'm going to document my findings, thank my patient for her time, and exit providing privacy